Defenseless under the night, our world in stupor lies. Yet dotted everywhere, ironic points of light flash out wherever the just exchange their messages. May I, composed like them of rust and dust, beleaguered by the same negation and despair, show an affirming flame. September 1st, 1939, by W.H. Auden in 1940. I'm Frank Speidel. Welcome to The Doctor Is In. I'm a retired emergency physician and recovering hospital administrator. I host this show not to practice medicine, but to question and discuss health care in the U.S. For guidance and healthcare decisions, I recommend you consult your primary care physician. I invite your robust skepticism of my comments. I'm human. I make mistakes. Now, from the first months of 2020 at the beginning of the COVID pandemic, many experienced increasing loss of confidence in those we counted on to have been prepared to lead and recommend actions. I put myself in their company. Increasingly, I found myself mouthing, "Where did you get that number? The article doesn't say that," to the latest authoritative broadcast by some trite-titled agency official. Contradictions and misspeaks were abounding, but never humility. I started with the last verse of W.H. Auden's poem, September 1st, 1939, written about the chaos and violence of World War II. He invites us to recognize that such times need individuals, the just, to speak out, to exchange messages, as it were, to show an affirming flame. In the midst of arrogant, swirling inconsistency, on April 20th, 2020, in the New England Journal of Medicine, I saw an affirming flame. Dr. Monica Gandhi of UCSF had published a cogent, documented editorial on the asymptomatic transmission of COVID-19. Dr. Gandhi's publications became the light piercing the darkness. Beyond asymptomatic transmission, Dr. Gandhi recognized and published the challenge of weighing and deciding on risks and benefits of COVID mitigation strategies. She clearly asked us to be aware of the harms of school closures and warned of the fearsome asymmetric damage to children already marginalized and at risk. Currently, we suffer from COVID fatigue. Most of us want to put those times in the rearview mirror. Not surprisingly, there has been sparse review at any level of the pandemic that killed over 1 million Americans and cratered not only the education, but the development of our children. Yet again, Dr. Gandhi shows the affirming flame. She has written Endemic, a post-pandemic playbook. I cannot say enough about her book. I have been giving this book, published in July of 2023, to friends and colleagues. It is written in a way that can be understood by those with no science background, yet comprehensively footnoted and referenced for those familiar with science and medical literature. As it were, a book for all readers. Endemic is no droll perusal of the pandemic, its effects. Beginning with her dedication to her deceased husband, Endemic embraces the reader with awareness of others. The book is a roadmap, not just for the science, but for living more humanly, more aware and caring, especially mindful of those with the least resources to manage in the dark times. I am honored to welcome back to the Doctors and Dr. Monica Gandhi. Professor, what did I get wrong?
Thank you so much. That is a very kind introduction to this book that's attempting to be, take the recent events and codify, I think, what would be a playbook for the future so that we don't make some of the same mistakes, but that we also build up back trust in public health. So I really appreciate being on your program today.
Thank you for being on the program. We've had an early and enduring presence for providing care for patients with HIV. How did that influence your approach to the COVID pandemic?
Yes, I mean that's actually it completely influenced my approach to the COVID pandemic. That I am an HIV doctor, and the thing about HIV is that early on, when it first came about, first described in 1981, there were people who were very judgmental about it. And what I mean by people is the current administration was very judgmental and said you have to stay away from people. And public health was more understanding that any infectious disease, everyone's can be at risk. It's part of being human, and so I wanted to take those principles of what I call harm reduction, do whatever you can to control the pathogen, but also take human needs into account, like schools, like the need for people to be together. That's called harm reduction, and put those principles in a pandemic response. So the fact that we were pretty non-judgmental in HIV, I was trying to bring that forward in COVID, because I think a lot of doctors and a lot of public health officials became pretty judgmental during COVID, blaming people for getting COVID, a lot of stigma around COVID. And I just thought there's no role for stigma or blame in public health.
In your book, one of the comments you made, which I thought was wonderful, is that we have to recognize that human beings are human beings and they will do things. And there is a certain harm in mandating and bumping people on the head. It's your fault. You didn't do this like we told you to. Caring for patients starts with caring for patients and recognizing they are human. I couldn't agree with you more.
Right.
Would I be right to say that you were willing to go against titled agency pronouncements for the sake of your patients?
Yes. So, for example, I'm the medical director of a large HIV clinic for poor patients in San Francisco. And I was told that I had to close down medical care for these patients. But there's something about seeing people with HIV in person, helping them with social services, providing that compassionate one-on-one care. And so I did do it for a little while. And then I said, okay, come on back, especially if you're homeless, because you have nowhere else to go. And there's no phone number and there's no safe place to do a video call. I mean, it just didn't work. It didn't work for the poor, to completely close down medical care. So yeah, I did go against kind of the public health dictums in the city and against some of the public health dictums by the FDA and the CDC, where the simple statement, stay at home, it was really hard to do that if you didn't have a home. And I think our response really did favor more wealthy individuals and not the poor. And they were the ones going out and doing the essential work. And so that's really why I came up with this, along with others, came up with this idea of resources before restrictions, and a harm reduction approach. Close down what you can. Bars are not as necessary as schools. But what the UNICEF chief at one point said to us is, why are the bars open and schools aren't, given how essential schools were for children? We just did everything kind of topsy-turvy in this pandemic, and I think it was probably political.
I could not agree with you more. I had the occasion one time of being tasked with being an ethicist for a large organization. At a conference, the legal counsel that was head of the ethics department posed a hypothetical question. And the right thing to do would have been to violate a HIPAA standard. This was a classic case of an unresponsive patient brought into the emergency department. The mother shows up and asks, is my daughter here? After she identifies herself and her daughter. And she says, she's been brought into a hospital. Is she here? Is this the hospital? The hypothetical question we asked, what are you going to do? Like a loudmouth, I said, you can come back as soon as we have your daughter stabilized. She's here with us. Right away, the counsel who was leading the conference said, do you know what you've done? You've broken a HIPAA regulation. We will lose our Medicare privileges. You had to have authorization from the patient to bring family member back.
But it's so compassionate. What you just said is the right thing to do in terms of principles of compassion. Not necessarily all the laws, but compassion.
The head counsel for this retreat for the large organization, which was a for-profit organization, theatrically said in the room, you did the right thing. That's what I'm here for. As long as you're doing what's right for the patient, You can break every written law, every published standard of care. As long as you're taking care of the patients, we'll take care of the law. I love that. Sometimes we lose sight that by following regulations.
Yeah, we had to take care of the patient and we had to take care of our who's in front of us. So I happen to treat a low income population, and that's who's in front of me. So what that meant was that in the city of San Francisco, the private schools were all open, the public schools were closed. So anyone who had means could send their children to school. Anyone who didn't have means, which were all my patients, could not send their children to school. Exactly. And it was, I needed to take care of the patient population that I serve, which is the poor.
We saw that out here in the Philadelphia suburbs too, where private schools were open and people could afford to send their kids to a different group of schools where they were getting educated, and those people who were the most challenged were marginalized again.
Yeah, and mostly racial and ethnic minorities. And so we deepened inequities during the pandemic from school closures. And so, you can say, oh, maybe this is just the time of reckoning. But I think we even knew at the time that school closures, prolonged school closures, were not right for children because we had never done that in influenza pandemics. We had always thoughtfully said, okay, children really need school, and close them as a last resort. So that's why we knew it was political. And I think this is the time of reckoning. And I don't mean reckoning in a harsh way. I think it means that we evaluate what worked, what didn't work, so that we can reasonably go forth in the future with a plan where we can keep the trust of the public for other pandemics. Because right now we're at a low in trust, and we don't want to be at that place.
There are some decisions that were made that didn't seem to square. During the summer of 2020, as I remember, the American Academy of Pediatrics put out one and then a modified position paper advocating how important it was to keep schools open. The risk-benefit highlights that you wonderfully highlight in your playbook seem to be almost neglected. Could you talk a bit about the fear-based versus fact-based decisions? How do we get to the spot where we were doing it out of fear and not out of fact?
Yes, I mean, I talk about this in the book, but American media actually amplified the fear more than anyone else. So there was a study that showed that the international media was portraying the COVID pandemic in line with the literature, with the medical literature. They would mirror the medical literature. The American media was always portraying bad news bias, always going for the bad news. And it didn't make sense because it wasn't paralleling the advances that we had in the medical literature, like vaccines work and treatments were working. It was always on the side of fear. I assume that's clickbait and people wanted, the media wanted people to click on their article. I also think that what happened in the summer of 2020 is the American Academy of Pediatrics, as you said schools are incredibly important for children. Then the current president, who is Trump, which usually public health officials did not agree with Trump, he said, okay, schools should be open. And then suddenly the American Academy of Pediatrics changed their mind. And so that's just pure politics, pure and simple, because you don't say one thing and then change your mind if a politician that you don't like says the same thing. So that, I think it was a mixture of politics and fear-based reporting. I can't explain why completely, while the American media was always on the side of fear, but I will say that the European media was much more reasonable, and they had a response that worked. Like they opened schools sooner because children were much less at risk. They got out the vaccine. They said life goes back to normal after the vaccine. People took the vaccine because they wanted a normal life. And then they just, spring of 2022, they said, it's endemic. We're going to move on, get people vaccinated, boosted if they need it. And it was so calm. And Europe did it much more less politically than the US did, and had better outcomes.
Yes. And that's not gotten widely reported. We don't want to look at things we could have done better.
No, there's a lot of reckoning that's happening right now, meaning a lot of people are writing articles. We should have done it better. We don't have a formal process like a commission or where we're putting together a pandemic playbook in a formal way. That's not the US way. They don't seem to be having a bipartisan commission on this, but there's a lot being written about it. Did we keep schools closed too long? There's a lot going on right now.
I would offer right now that my county medical society has undertaken to look at our response to the pandemic, what we did well and what we could have done better, and where we can improve, because there has been such a sparseness, such a reluctance on the national level, except for your book. And there's also a work group, the COVID work group came out, as I'm sure you're aware. I think there should have been a national group, just like the 9/11 report.
Yeah, like a commission on that.
Yes.
Exactly right. Because that is what other countries are doing. And it's a very, I think it gives you like reassurance in the process that we will look at what went wrong, what went right, and it will set a framework for the future. But the US isn't doing it. We're doing it in fits and starts. People are writing pieces or books like this one, but we're not doing it in an organized commission way. And I think that's too bad. We're being very political about it.
The CDC did a look back, and the CDC's actions and behavior, which I thought was a very healthy thing to do. One of the things that I was impressed with, what the CDC look back said, was they noted that they were very reliant on observational studies. Is there a difficulty in making public policy based on observational studies as opposed to randomized controlled trials? And particularly, would you talk about the Provincetown study, which was one of their observational studies published during the pandemic?
Yes. I mean, one thing about observational studies is that you may not control for what we call all the confounders. So the good thing about a randomized controlled studies is one half the population is given this and one half the population is given this, and you can really see if something works. And the biggest controlled study on masks, I was a big proponent of masks at the beginning of the pandemic, but to be fair, I changed my mind that they weren't as effective as we thought, because in a randomized study, this Bangladesh-based study, randomizing communities to masks versus not masks, didn't seem to work that well. And I think people don't like to wear them, and they don't wear them perfectly all the time. And the Provincetown study was, we had just gotten vaccines. Everyone had gotten them because April 2021, we opened vaccines to everyone in the United States after risk groups had gotten them first. And then there was a Provincetown gathering. This is a yearly event in July of 2021. Mostly gay men come together in Provincetown. It's called P-Town. It's super fun. It's like held every year. A lot of people inside, really crowded conditions. It was raining, so the windows were closed. And so there was a lot of COVID spread, but people didn't get really sick because they had the vaccine. So actually, it was a success story of the vaccines. They worked.
Exactly. The message was that the vaccines prevent. I don't think there was any mortalities in the Provincetown experience, was there?
No, definitely not. 4 people got hospitalized, but out of caution, and then they were released really soon. No mortality at all. And it was a really success story of the vaccines. And what we could have said was, yay, the vaccines work. They just got majorly stress tested, and they perform beautifully to preventing severe disease, which is why we have vaccines. Otherwise, we wouldn't have developed vaccines for a cold. And this was a major success story. Instead, the CDC said, let's put back masks. This is really, we didn't expect that we would get breakthroughs, but we always get breakthroughs. We want to prevent severe disease. So they really took a public health messaging opportunity and squandered it there with the P-Town event.
Exactly. The message that came out was go back to masks.
Right. That just made people doubt the vaccines, really. I mean, if the vaccines weren't going to unlock the key to normal life, then what would? What were we waiting for?
But again, doubting the vaccine. Unfortunately, the head of the CDC initially said that if you got the vaccine, you couldn't spread the disease. That's not true. Okay, but when she said that kind of reinforced the distrust of those people that were supposed to believe it.
I think what happened is the vaccines did prevent spread early on. They stopped by the time we got to the Delta variant because they didn't work. The antibodies didn't work as well against Delta, and our antibodies go down over time. And then that messaging should have happened. Oh, okay. They no longer prevent transmission. So that means that we shouldn't be mandating vaccines. And the reason that was important to say is the World Health Organization said, let's really discuss, they put out a brief in May of 2022 that they said, let's really discuss mandates. If they were preventing transmission, the vaccines like the smallpox vaccine does, you can mandate. Once they stop preventing transmission, you need to stop the mandates. And that's what the WHO put out. It was an ethical document. And so we should have said in this country, oh, wait, things change. Let me tell you about science. Science does change, and just put out really clean messaging. Okay, did stop transmission, now doesn't. So we got to move on. So it just wasn't, it was almost like there was a doubling down as opposed to changing the message as the science changed.
Professor, so spot on. David Hume, the Scottish philosopher, observed that truth springs from arguments amongst friends. But it seemed like those people who were heading our public response, it seemed like they were more interested in talking at us, including people at the bedside, than dialoguing with us. I think we'd be better served if there had been a dialogue from the people who were seeing and touching patients.
Yes.
And those people that were entrusted with the microphone. Am I off on that?
No, I think there's a section in the book, chapter 6 is the duty of public health. And in this book, and the duty, one of the main tenets of our duty, I think, is debate and dialogue. And that's what I talk about, is that it seemed like the people who were messaging about COVID in this country were not actually clinicians, were not around patients, and all of their woes, that there was COVID and how difficult that was. And then there was the difficulties of school closures. I think if you were talking to real human beings, you became a more trusted messenger. And we didn't have debate and dialogue in this country. It was like one way or the highway. Yes. And again, it was just really from the top dictatorial. And it was surprising because that's not how I think of public health. I think of public health as a discussion between public and public health officials, the two going together hand in hand. They have, if you're going to serve some group, a community, you have to get the input from the community. But there were these statements made, stay at home, wear a mask, save lives, don't go to work. All of that was really just sound bites, but it didn't talk to the nuances of people's lives and how difficult it was to go to work if your school was closed, and where was your child supposed to go?
Exactly. It was like there was a group of people that had to follow the rules and a group of people who could go to private schools and to have their children educated.
Yeah.
As your book says, we need to look carefully at how we responded to this pandemic. Here.
Yeah. Exactly. This is to build trust. This book is to build trust, I hope.
Absolutely. I cannot say enough about your taking the time to be a guest on the show here, Professor.
Thank you so much.
Professor Gandhi, I want to thank you for being a guest on the show. More importantly, I want to thank you for being the affirming flame in the dark times, for mitigating our fear and confusion with science and nuanced reflection, and for inviting us to keep our caring humanity in bad times. As you talked about patience, we have to see the patient. It's not about getting great numbers and results. It's about taking care of people. And I think your book is a message about keeping humanity in bad times. And I think it should be required reading for all those holding office, elected or appointed, and for all those teaching at any level. It has been a gift. It has been your gift to us and for our viewers out there. Thanks for taking time to watch The Doctor's End. Stay safe and read Endemic.